Will you welcome now the 2021 UCD Alumni Award winner in Health and Agricultural Science from Geneva, Dr. Mike Ryan. Mike, you're very welcome.
Thanks very much, Pat. Good to be here.
You are in the throes, as we all are, of a pandemic, but you are very much on the front line. It's been said that this won't be over until the world is vaccinated. Are we winning?
We are and we aren't. We're certainly winning in some parts of the world, Pat, and the promise that vaccines brought are beginning really to bear fruit. We're seeing really important decoupling of the case incidence of disease from hospitalization and death. And what we're seeing is the impact of the epidemic on our loved ones in terms of hospitalization and premature death, in terms of the impact on our economy and our social lives is decreasing rapidly in those countries who have access to vaccine. But that is still not the case in a vast tranche of the world. So we haven't done so well in sharing the benefits of that fantastic gift we've been given by science. A lot of work to do. So I don't know how we grade ourselves. I think the Secretary General said it at the UN General Assembly last week. He said we get an F in ethics, and maybe that's the score we should be really most concerned about.
When you cast your mind back to the beginnings of this pandemic and this strange virus which came out of China, and we didn't know the extent of it, but in the WHO, part of your job is to kind of imagine the impossible, and we've seen the impossible. When did you become really, really concerned about what might unfold?
Immediately. I mean, this unfolded over the New Year's, and we were fully engaged in this from the very first moment that the report came of a cluster of atypical unusual pneumonias, and took immediate action to verify that, because we had a previous experience with MERS, with SARS, with avian influenza. Any cluster of unexplained pneumonia has to be rapidly investigated. It is difficult to characterize that when you have an unknown virus and when you're dealing with the background radiation, I suppose, of normal respiratory disease and winter and seasonal influenza. But that's the job, is to work out that signal. And certainly our whole system was activated from the very first day. In fact, we established our incident management system within 24 hours of the first signal of the disease.
When you look back with your experience of MERS and SARS, you could say, well, they were regionally contained. But yet, I suppose you always have to imagine that the next one might not be regionally contained. And that's what happened.
Yes, but the last pandemic in 2009 was not regionally contained. It spread around the world very, very rapidly. The advantage we had at that time was the virus had very low severity. It's the combination of transmissibility and severity that has really highlighted the impact of this pandemic, much like the 1918. So it's understanding not only transmission dynamics, but understanding the impact, the severity of a disease that determines whether it's a true pandemic or not.
Can you remember the moment in Geneva when you got the word, we think there is a vaccine? The first one, I think, was Oxford, which is a more classical vaccine. And then we had the mRNA vaccines from Moderna and Pfizer. Can you remember the reaction in the WHO to that breaking news?
I think we always knew we were going to get vaccines, and the platforms that were being used, the AstraZeneca one, is a new platform too, relatively new. It's a vector vaccines, and we've used them and developed them for Ebola and a small number of other diseases. So both of those vaccine classes were being developed, through innovation, and there was an incredible sense that it could be done. I think the thing was we were so pleasantly surprised with was, number one, how quickly that work was done, and more importantly, then as the studies were done, just how effective those vaccines were. Because we don't expect that with first vaccines often. We don't expect our first innovation to be the best. Our first innovation, the history of innovation is you develop a countermeasure and it kind of works, and then you enhance it and you improve it and you get a better second version, third generation. We were very lucky. I think the world was very lucky. And it shows just what we have at our disposal in terms of technology nowadays for good. So in that sense, our connectedness that made us very vulnerable to this virus, that scientific connectedness around the world gave us the fastest ever delivery of effective vaccines in the face of a global threat that in any time in human history, which is huge. So relief, I think, Pat, was probably the biggest sense, because we were in a very bad place. The disease was continuing to transmit. The hospitals were full, ICUs were full, graveyards in many countries were filling up. We could see the oxygen crisis looming. The systems around the world were under huge pressure, and our social and economic lives were being shut down. So the vaccines brought a hope, a ray of light. I think I heard you say that, a light at the end of the tunnel at one point in one of your interviews. And that's exactly what it was. But you know, you can still lose your way, even if there is a light at the end of the tunnel. And you know, we're still not there yet.
The light at the end of the tunnel could be the oncoming train, which is what we're all worried about. When you cast your mind back to UCD, I bet there was no way you could have foreseen that your medical career would take you in this direction.
No, and yeah, it's sliding doors. I'm sure it's the same for you, Pat, and many other people. Everyone thinks there was a big master plan, and you know, you must have planned this all the way through, and nothing could be further from the truth. I was very lucky to come to UCD. I had very severe back injuries and in an accident, and had to leave surgery. And actually, it was Cecily Kelleher, who was then in Galway, who sort of took me in more for mental health reasons, to give me some occupational therapy and helping with some community surveys. And Cecily said, you know, you're not so bad at this, Mike. Maybe you should go and do a master's in public health in UCD. And it was ultimately life circles. Cecily ends up ultimately as the professor of public health in UCD after her career at UCG. So I have a lot to thank Cecily for, not only for what she does in UCD, but for the opportunity she gave me and the mentoring she gave me. Because it's tough to switch careers. It's tough to change track when you're so committed to going down one track, and you can feel very resentful and very unlucky that all of this future has been taken away from you. And sometimes you need calm and smart people to guide you back. So in many ways, UCD was the moment at which I transitioned from one career to the other, and it gave me the basis to put my life and my career back on track.
What advice, therefore, would you have for the medical school undergraduates at the moment, in terms of they're looking maybe to find a direction?
It's we've all got to pursue our scientific objectives and our learning objectives, and we've got to get our degrees, and you know, we've got to learn the craft, and that's really important, and we've got to apply that craft. But I would just say, looking at this pandemic and everything we do, is not to forget the individual, not to forget that patient who sits in front of you. We serve them. It's not the numbers, it's not the statistics, it's not the chances of this or the chance. We talk in percentages, and we talk in numbers, and we talk in incidence, and we talk in survival rates, and we talk in all of this very important metrics of health. But just don't forget that you're primarily there to serve citizens and to serve people, and each and every individual comes to you with a unique background, a unique history. And learning how to engage your patients, their family, their community, and understanding that it is often, you know, hugely long periods of time that people have developed health risks, developed conditions that are as much to do with social inequity and exclusion, lifestyle, and other things. And that we need to be not just practitioners of health, but we need to be activists for health justice. And we need to use the voice of the medical and scientific community, not only to innovate, but we also need to speak up on behalf of the people that we serve.
I suppose as you hopefully bring this pandemic battle to a close, that you and the WHO are already trying to look over the horizon at the next potential pandemic.
Mm-hmm. Yeah, we just had disease X, but there's another disease X around the corner. You know, I'm filled with, at one sense, trepidation at the risks we're generating on the planet in terms of how we as humans are stressing our social systems, the climate system, the health systems around the world, and we can't separate those anymore. Social equity and health equity and climate justice can't be separated. And I hear Mary Robinson speaking about this all the time. She's been speaking for years about it. I, at the one hand, feel that we're sort of heading down, as you said, that freight train that's oncoming, that light. And on the other hand, I'm filled with hope because I see what human innovation can do. I see what human connectedness can deliver. I see what human ingenuity and solidarity can actually deliver. So I'm pathologically optimistic that I think if we can recognize that our fate is in our own hands, that our destinies are intertwined, and we have the collective intelligence and the collective compassion, we can actually forge, not going to a new abnormal and going back to, people talk about going back to the, a new normal. I really don't want to go back. I think what we had before was abnormal in the way we were managing our planet, managing our biome, managing our societies, managing our health and health systems. If we could just, I think, recognize that we have the collective capacity to make this a better place for our kids, and then we could commit ourselves to that, because I'm conscious of the fact that we're potentially leaving a planet behind to the next generations that we haven't managed very well.
Finally, Mike, this Alumni Award, what does it mean to you to be reminded once again of your time in UCD?
Yeah, well, awards are awards, and I'm sure you've received a few of them in your time. I think what's nice for me personally, I think there are huge numbers of Irish graduates and Irish people abroad, or peacekeepers, people who work at NGOs, people who work in international science and medicine all over the world. We often get disconnected from our roots, and we're prodigals, a global tribe. Sometimes we don't feel as connected, we don't feel as valued in our home country. I think it's just lovely that the diaspora of those of us who are abroad, and I hope holding up Irish values of tolerance and compassion, that this award is for not just for me, but for all of those Irish people who work abroad in the service of humanity.
Dr. Mike Ryan in Geneva, thank you very much for joining us.
Thanks, Pat.